everyone, it is Dr. Cree. Welcome to the Dr. Cree and Me show. We come on every Monday at 7 p.m. So we're going to wait about 3 or 4 minutes for people to start coming into the room. Hey, when you get here, say hello. Tonight, we're going to talk about breast cancer because it's October, and October is Breast Cancer Awareness Month. Hey, Sharika. So when you get here, put your name in the comments so I can tell you hello. Hey, Miss Pam. Hello, 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 hello. So we're going to give people about 2-3 more minutes to get in the room. Hey, Tanya. So we're talking about breast cancer today. Hey, Dave and Denise. Thanks for joining. We're going to talk about breast cancer, and this is for women and for men. So it's Breast Cancer Awareness Month. A long time ago, they used to have where you can get a mammogram for $99 during the month of October. Hey, Miss Coleman. So I'm not sure if they still have that special going in the Birmingham area. So we're going to wait about 2 more minutes. We're going to get started because I got 5 things that you should know about breast cancer that you may or may not know. So I think that it's important. And probably the month of October, I'll have some different little nuggets. We'll maybe talk about a different kind of cancer, maybe prostate cancer next week and ovarian cancer the week after that. Hey, Tiff. So I think I'm gonna go ahead and get started. So you know who I am. I am Dr. Cree. I'm a board certified family medicine physician, and I specialize in what's important to you. Through my tips and educational setting, we talk about how to make you a healthier you. So you know better, you can do better. So I'm teaching you to become a better you. So number 1, 5 things that you need to know about breast cancer. Someone put in breast cancer usually does not hurt. So number 1 is breast cancer usually doesn't hurt. Contrary to what you think. So I get a lot of women that come in and say, hey, I got this lump, but it really, really hurts. It changes. And usually we still have to get a mammogram. We still do an ultrasound, but usually there's a characteristic feel to breast cancer. It actually feels like a rock. If you ever reach up there and it's like, it feels hard as a rock, then that very well could be a breast cancer kind of knot. So there's what are the signs? You can have 1, you can have a new lump. You can have scaly skin, like how if you get eczema or if you got a dry scaly patch, you shouldn't really have those on your breast. So if you have a new scaly patch on your chest, breast region, that may be something to bring to your doctor's attention. Number 3, if you're having any nipple drainage, it could be any color, clear, white, yellow, greenish, any kind of drainage at all from your nipples, then we need to actually take a look at that. And the other thing is if your nipples start to turn in. So, if you get cold, your nipples get hard. But if they kind of retract in, then all of those could be signs of cancer. So a new lump, scaly skin, nipples retracting, and even nipple discharge. So number 1, breast cancer really doesn't hurt. It actually feels like a rock. That's the best way that I can explain it. Number 2, yes, you need your mammogram. So I had my very first mammogram on last week or a couple of weeks ago. And I was so nervous because I had heard all these horror stories about how they put your boob up there and they smash it down. And so I get in there, and the machine does not look anything like I had imagined. First, I thought it was like this big old, huge machine that was like silver and sterile. So I get in there, and I see that the table that you sit your breasts on is actually plastic. So I start to laugh, and I laugh almost until I cry because I'm like, oh my gosh, this looks nothing like I thought it was going to look. And the lady was like, well, why are you laughing? I said, a lot of women refuse to get their mammograms because they said it hurts. So she said that she thinks it's about the technique. So they set the breast up there. Then she had to turn a certain way, get that image. And then I also had to hold my arm up, get that image. So we did that on both sides. It took maybe 10 minutes, if that long. I don't even think it took that long. So it was very quick. So I am 36, and at over 35, African American women can get a baseline screening. So I won't go back again until I'm 40. So that's why I got my mammogram. So yes, so screening actually starts at the age of 40, and you need them once a year. So every single year, decide what month you're going to have your mammogram. Usually make it around the same time that you have your pap smear, and then just go with it. It is not that bad. It was really not that bad. So number 2, if you have a relative, a first degree relative with breast cancer, then you need to get tested 10 years before they got their diagnosis. For example, if your mom was 40 years old when she got her breast cancer diagnosis, then you need your first mammogram at 30. Hey, Cookie. So 40 years old, she got a diagnosis, then you need it at 30. Well, she was 45 and she got the diagnosis, you need it at 45. Yeah, if she was 45, you need it at 35. So 10 years prior. Well, what if she was 90 years old when she got the diagnosis? Then you just start at 40 and you continue to get it yearly. So make sure you know how, if someone in your family, that's your mom, your grandmom, your sister, make sure that you know the age that they were when they first got diagnosed with breast cancer. And then 10 years before, you go get your mammogram. So, okay, also, as far as mammograms are concerned, you need to know, yes, touch yourself. Hey, Jolene. So, yes, I also know that deaths are actually on the decline for breast cancer, even though breast cancer is the second most common cancer for women, because the research is phenomenal. There's so many, there are pills now. I had a woman to say, she said, since I saw you, I got breast cancer. I was like, well, whoa, Lord, you look so good. And she was like, I had a mastectomy on this side. The cancer was not in my lymph nodes, and I only have to take a pill a day. I don't even have to have any radiation. So if you get breast cancer, you don't necessarily have to you don't necessarily have to have chemo. You don't necessarily have to have radiation. You may be one of those that you just have to take a pill. So there are pills to treat. There are so many different things out there. Also, make sure that you know that you still need to do your self-breast exams, because mammograms may not necessarily find the lump. That's just it. There has to be some kind of, disclaimer that they say, hey, even though we're looking at your breast, we may miss something. So you need to know what feels normal. So if something does not feel normal, you will know. I had a patient to say the way she was diagnosed with her breast cancer was her husband felt it. And they were intimate, and he was feeling her breast, and she was like, he was like, well, what is this? Something is wrong, which triggered her to go and get checked, and lo and behold, she had breast cancer. But she is a breast cancer survivor, and she's doing well now. So number 1, breast cancer usually doesn't hurt. It feels like a rock just sitting there. Number 2, yes, you need your mammogram. And number 3, as I just alluded to and Jolana said, it's important to do your self-monthly breast exam. So pick a day. So usually I tell women, hey, the last day of your cycle, while you're in the shower, just hold your arm up. Start on the outside, work your way in, and then go up in your armpit. This here is breast tissue as well. So start on the outer, use this part of your hand, and then work your way around the breast, all the way around, and then move your hand up, because this area right here in your armpit is actually breast tissue. So you need to know what your normal is, because I got lumpy breasts, so I know that that's my normal lumps. Nothing to be concerned about, because that's my normal lumpy bumpy. You need to know quickly if something comes up from one month to the next, that you can bring it to your doctor's attention, because no one's going to know your breast better than you. So know that also there's something called fibrocystic changes, which is aka lumpy breasts. So you may have cysts, a little small, like, that hurts, that's tender. It could be tender because it's that time of the month, ladies. It could be tender because you've had too much caffeine, too much chocolate. So there are a lot of things that can cause you to have more cystic or more lumpy breasts throughout the month. So, hey, Miss Yetta, how you doing? So if you do find yourself having some changes, look at your diet. Look back and say, hey, am I drinking enough water to kind of, get myself, detox myself? Am I overdoing it with caffeine? Am I overdoing it with chocolate? Back off on some of those things and see if that doesn't get better. And also your doctor needs to do a once a year self-exam as well. So that is still within the recommendations. So monthly breast exams by you, once a year breast exams by your doctor. And number 3, your yearly mammogram starting at 40 years old or 10 years before your closest relative diagnosis for cancer. So, all right. So number 1 was cancer doesn't hurt. Usually feels like a rock. Number 2 is yes, you need your mammogram. 36 years old, African American, 35, 36, you can get a baseline. And then you repeat it again, starting at 40 once a year. Number 3, it is important to do monthly breast exams. And number 4, yes, men can get breast cancer too. That is a big one. So somebody right. Number 3, we offer number, but anyways, we can say number 5. Yes, men can get breast cancer. I have a cousin who actually had breast cancer. Thanks, Cookie. Hey, he had breast cancer. One of his aunts had breast cancer. Both of his sisters. One had ovarian cancer. Another one had breast cancer. So when he got it, because breast cancer can be hormonal, it can be genetic. So, you have to know that, hey, if you find a lump in your man's breast, or he's like, something doesn't feel right, do not chalk it up. Do not chalk it up. It's easy to say, hey, let's go to the doctor. Let the doctor get an ultrasound on it. And then from there, we can say, hey, well, that looks suspicious, so we need to do a biopsy. So I had a cousin that had it. It's usually linked to genetics, and likely if a guy has breast cancer, his mom has had it as well, his sister or somebody in his very close degree relative. So number 1, breast cancer doesn't hurt, feels like a rock. You need your mammogram. You need to do self-breast exams. Men can get breast cancer. And number 5, if you have dense breasts, you're at increased risk for breast cancer. So here at St. Vincent's, they when you get your mammogram results, you get a letter that says, hey, your mammogram was fine. So I get my mom's results and I call her and say, hey, Mom, your results were fine. Mammogram, no big deal. Go back next year. So she calls me about 3 days later and she was like, well, I got something in the mail that said something was wrong with my breast. And so I'm like, well, what are you talking about? Well, here they send a disclaimer home with every woman's mammogram results, and it says, hey, you had this dense breasts, and because you had dense breasts, it makes it kind of the imaging a little bit harder to read. So you could have a little small lump in that very dense area. So let's talk about that, because a lot of patients have a lot of questions about what does that mean. So the dense tissue is made up of less fatty tissue. So fatty tissue will be lighter on the image, and the dense breast tissue will be darker. So as you can imagine, if it's darker, it may be a little bit harder to see any signs of cancer. So milk glands and ducts. So younger women likely have more active breasts, so you'll have more dense breasts. But as you get older, you think you replace it with more fat, but some women still have dense breasts. And they have this scale that they use, if it's a little bit dense, or if it's a lot dense, or no dense. So if you even have just a little bit of density, you're going to get that note in the mail that say, hey, ma'am, you have some dense breasts. That doesn't mean that just because we say you're negative, there still could be a suspicion of something that they miss, because they have to cover themselves, just in case they miss something because the area was too dense. So dense tissue is made up of less fatty material like milk ducts and glands. Dense breast can be hereditary. So my mom had gotten a sheet for dense breast. And lo and behold, when I got my results back, my results were normal. But I had a little dense tissue piece of paper in there, disclaimer as well. I said it can make it harder for your breast cancer to be detected. And then they measure it on the scale. So number 1, breast cancer usually does not hurt. I have felt it several times and it feels like a rock, like literally a rock just sitting there. Number 2, yes, you need your mammogram. Number 3, please do your self-monthly exams. And don't forget this area. Like if you hold your hand like that area right there is breast tissue. So don't forget that part as well when you're examining. Men can get breast cancer too. And dense breast can make the cancer harder to find. And you're at more risk for breast cancer if you have denser breasts. So, what questions do you have? You're welcome, Miss Pam. What questions do you have? Do you have any questions? Any comments? Next week, we'll talk about some other kind of cancer. Maybe we'll talk about prostate cancer next week. So I'm going to do cancer series all this month since it is Breast Cancer Awareness Month. So make your donations to some worthy cause. Thank you, Miss Ware, for coming. Make donations to a worthy cause. Get out there and do the cancer walk. The Susan G. Komen walk is actually coming up this Saturday. That's it, Tiffany. Usually they just have the lump, the scaly skin, nipple discharge, retraction. Of course, when you get cancer, some people lose weight. They have decreased appetite. Oh, you got a question, Miss McCants. Hold on, wait a minute. So you got the physical symptoms, but you also can lose weight, lose your appetite. Hey, my mom and dad on the thing. Hey, y'all. So just FYI, know that that usually is those signs that I said, but you also can have some weight loss as well. Go ahead, Miss McCants. What's your question? Hey, Darlene, you registered for the Susan G. Komen thing, walk. Awesome. So, Miss McCants, what's your question? So this is really important because a lot of women kind of put this on the back burner, but we really don't need to be putting this on the back burner. We need to make it very important. Darlene is a breast cancer survivor, and we're so happy for that. Tiffany Posey Wilson's mama, Babby, she's a breast cancer survivor. We prayed through that. So we have a lot of people. It's very rare that you don't find someone that cancer has not affected someone in your close proximity. Miss McCants, are you typing your question? Oh, she said she would get the notice all the time about the dense breast. Right. So you understand now that, hey, that just means you still got more active breasts. You have more active breasts than you do just a glob of fat that's just sitting there. So, anyway, if there are no questions, hi, Keisha, no questions, comments, concerns, you know who I am. I'm Dr. Cree. I am a board-certified family medicine physician, and I specialize in what's important to you. Through my tips and my educational tools, I help you learn to live a better, healthier you. So make sure that you follow me on Instagram. Check out my Instagram. That is at Dr. Cree, DOCTORKRE. Again, that's Dr. Cree at DOCTORKRE on Instagram. What about 3D? Miss Pam, we don't do much 3D imaging around here in Alabama. I mainly focus on when they get screening, and I'm assuming once the screening is done and they find something, since I'm on family medicine, I refer them on to the breast doctor, and I think the breast doctor down here does that pretty frequently, but I don't. How young is too young to get an exam? So 40 years old is when you should start getting your mammograms once a year. But as soon as you have a teenager, you teach them how to do the breast exam and teach them every month that they need to be doing the breast exams. Thank you, Miss Carol, for that question. So I would start saying doing exams as soon as they get their periods and they have breast enough to be able to feel their breasts, just start showing them. So, because of course they're going to forget. She's 18. Yes, you can start doing breast exams now. And then when they go for the for the pap smear, usually the GYN feels the breast at that time. So, should Marie get checked at 30? How old were you when you got diagnosed, Darlene? Were you 40? If you were 40, I think you were young 40s when you got diagnosed. Maria, how old were you when you got diagnosed, Darlene? So you were 35. So no, Maria should have got hers at 25. So that sounds obvious. So if she is, how old is Riri now? 28? 27? However old Riri is now, let her go ahead and get her, let's start getting her mammogram, at least a baseline, because you were 35 when you had yours. So it's time for her to get a baseline mammogram. Miss Pam said last time, yeah, she's time for her. She's 29. I thought she was 28 or 29. Last time I had my mammogram, they said next time I may need a 3D. Just wondering why. It could be because your breasts are dense. Did you ever had any lumps that they had to biopsy at all, Miss Pam? Or any new lumpy, bumpy changes? They may be saying to do the 3D because they saw something and they want to get a better monitor. So they never had you to come back and do a special view of your mammogram. So I'm thinking that you may have maybe the density of your breasts, that they're like, okay, your breasts are dense. We want to make sure we're not missing anything. Let's do the 3D image. Just lumpy always have been. So because you have lumpy breasts, I assume that you that they are probably looking and saying, could that be something? Could that not? And because of all of the lumps and bumps and your age, you should be having breasts to kind of slow down all that activity. But since you must have perky breasts that's doing what they like to do, and that's continue to make hormones, they probably want to do a 3D to make sure that the lumps and the bumps that are there are not anything to be suspicious about. So that was probably why. Any other questions? Y'all had some good questions tonight. Any other questions? Well, you know what? Thank you, Miss Pam. You know I am again, Dr. Cree, board certified family medicine physician. Thank you for joining tonight. I specialize in what's important to you and helping you live to be a healthier, better, well, balanced you. So follow me on Instagram at Dr. Cree. That's DOCTORKRE. See you next week.